Hi, welcome to Bonds After Baby. I'm LMFT Evie Empress, and I'm here to help you and your family relationships experience more relief and connection during the stage of pregnancy, postpartum, and early parenthood. Remember to subscribe for my podcast here and on YouTube and sign up to my email list on my website, bondsafterbaby.com, for free resources for your family. In this episode, I'll be introducing how postpartum distress is actually family distress, not just mom distress. Okay, this is the hill I will die on. I think all professionals have to get more familiar with seeing postpartum adjustment as a family issue rather than an individual one. Today, I'm focusing on couples and co-parents primarily, but I will say if you're raising your child with a grandparent or extended family member, much of this still applies. Okay, so how does couple coping affect the adjustment to baby, and how can couple coping protect members of the family when children come from adjustment distress or anxiety or depression? And at the end of the episode, I'll offer 3 questions to ask with your partner to start noticing how your family coping affects you all and get these discussions going. In another episode, I'll branch this out to grandparents and other family members for sure. So, I'm going to be touching on how postpartum anxiety and depression relate to couple functioning, but even though I'm mentioning anxiety and depression, I want to remind you that this podcast is not a substitute for mental health care. You are not my mental health client in this setting. If you are experiencing anxiety and or depression, please reach out to a mental health provider. And if you're having suicidal thoughts, call your local suicide hotline immediately. 25% of mothers report postpartum anxiety, depression, or adjustment difficulties after birth. This is the most common complication of childbirth: anxiety and depression, mood disorders. And this is just the mothers who get screened and who report. This is likely a much higher percentage, okay? Anxiety symptoms include, but aren't limited to, excessive worry thoughts, a sense of overwhelm, difficulty focusing, nausea, foggy thinking, rapid breathing or heart rate, excessive intrusive thoughts. And depression symptoms include, but of course aren't limited to, loss of enjoyment, low energy, fatigue, a pervasive feeling of sadness, having a lot of hopeless thoughts, and harsh thoughts towards the self. Adapting to the new role of parenthood, we've discussed this in other episodes, right? It is a massive shift in your life cycle stage. If you're the birth parent, there's also significant physical and hormonal recovery. Due to biological, hormonal, individual, and environmental factors, it's very common to experience distress during the months after birth and beyond. And moms often feel shame for the struggle, which is such a cruel spiral to be in. Please see the shame spiral episode number 6. What I've seen in my clinical practice is confirmed by research. Satisfaction in relationships and community lessens postpartum anxiety, depression, and adjustment struggles, and is very protective from these symptoms as well. So this really clues us into the reality that these struggles do not occur in isolation, and they don't just originate like on an island from one person. What is relationship satisfaction? At its core, to put it simply, it's the experience of feeling supported and cared for and knowing you are not alone in the struggle and in the joy. To see postpartum distress as an isolated experience originating or just being experienced for moms is simply, unequivocally, in my professional opinion, incorrect. Individuals are always impacted by a whole ecosystem of factors. Think about it. Are cultural or societal expectations of parenthood and motherhood very different than what you're actually experiencing? Are there genetic or biological factors that heighten your experience of anxiety or depression? What about community, systems or connection to community, support, family trauma history, financial factors, work? I could go on. And especially your family relationships, right? The people that you are connecting with and relating to on a daily basis. One of the most effective and rapid means of finding relief in this time is helping relationship bonds and coping. I'm going to review the most common ways couple relationships affect postpartum struggles and how postpartum struggles then affect couple relationships. Again, this is a huge topic, but I'm just getting into the most common hitters for now, and I'm going to use an example just to get a window into what I'm talking about. So, moms dealing with postpartum distress can experience more fear as opposed to pleasure. They've done these like fMRI brain studies, and they've noticed that when women are experiencing postpartum anxiety, let's say, that the like fear receptors in the brain get activated much more than the pleasure. This affects a confidence as a parent and can affect the bonding capacity with a child. Partners of birth mothers also experience postpartum anxiety and depression, and sometimes experience a lack of social support as well that they're in need of, an alienation from mother-infant bonding at times, and certainly a lot of adjustment stress on their own, right? Their roles are changing as well. The couple dynamic changes. So a lot of similar kind of adjustments. Interestingly, if one parent has postpartum anxiety, depression, or an adjustment difficulty, the chances go significantly higher for the partner to also experience the same. And this illustrates a kind of contagion or loop that happens between couples. It's no one's fault. There's likely a co-created dynamic that already exists. And dynamics perhaps originating in family of origin, family you grew up in, that are repeating themselves in your current couple dynamic. When there's a ton of stress added to a dynamic, coping gets harder. So for example, like if a couple is functioning, things just aren't as challenging, even if coping methods aren't like particularly healthy, right, in the research sense. But couples are getting by. When there is the stress of this huge major life change, the old coping methods don't work anymore. Um, Let me give an example to give just like a picture of what I'm talking about. So let's say there's a couple. Let's say it's a lesbian couple, wife A and wife B. Before having a child, wife A and wife B usually avoid talking through conflict. This is what they got used to in their own families, when they were kids, and they're just, so they kind of co-created this dynamic where they continue this. So they might brush uncomfortable discussions under the rug and hold feelings in, and things are a little tense until things blew over, and then they'd reconnect. Up until this point, avoidance hasn't been the best thing for them, but it didn't cause any major problems or ruptures yet. Once things blew over again, they would connect pretty well. So once wife A gives birth, she starts feeling very alone in the constant caregiving. She's struggling with breastfeeding around the clock, meets most of the baby care demands, and has decided to stay home and stop work, while wife B works really long hours. Wife A feels really angry at the lack of wife B's involvement in the baby care, and just feeling unsupported and emotionally unsupported. And wife B is angry at not being appreciated for her hard work and stress to make sure she meets now all the financial needs for the family, because wife A isn't working. And wife B is experiencing a lot of just depletion as well. So they get into this kind of like passive aggressive jabs at one another, but they're not dealing with their conflict and feelings and needs. They're not expressing them, right? They're both sleep deprived, adjusting to this massive change in their lives, and it doesn't fizzle out like usual, leading to kind of reconnection, but rather it begins to build a denser and denser wall between them. Wife B begins to withdraw as like goes into shutdown when perceiving that nothing she does is good enough, and wife A experiences depression as she is repressing her feelings of anger and unmet longing for support. There are less and less moments of connection, intimacy, and perceived support on both sides. And wife B starts to also begin to experience depressive symptoms because there's feelings that she's also repressing as well. This affects their interactions with the baby at times. Sometimes when they're both feeling depressed or having hopeless thoughts, their presence with their baby becomes less engaged or distant due to some of these depression symptoms. Okay, so here in this little snapshot of an example, we can see how both partners are suffering and experiencing a massive adjustment to these new roles, and they just don't have the coping skills in their relationship to have a compassionate, productive discussion, right? Even just to work out logistics of their situation, to try to manage, and more importantly, to meet each other's emotional needs, just to acknowledge kind of the mutual struggle they're both going through, even that, right? So we can see how there's a feedback loop. It's related. As they each feel alone in their struggle and unsupported, they co-create a kind of dynamic where these passive aggressive, punchy reactions to each other are actually like building, right, leading to more and more anger, which they're not dealing with or expressing, which builds a denser and denser wall. It leads to more distress. So do you see here how, yes, there's individual struggle that they're going through, but they feel alone in their struggle, and it's hard to express themselves and to listen to each other. And this is leading to more intense depression symptoms. Their individual stress could have been lessened if they had more relationship coping skills, right? So a lot of this suffering could have been avoided. I'm not saying there isn't still like a massive adjustment and there's going to be tension and annoyances, sure. But really, the deeper suffering could have been avoided if they had some coping skills set up of how to communicate, how to be able to hold space so that both can have, there can be mutual compassion for what they're going through instead of this like adversarial thing that comes up, right? A suffering Olympics, as I've mentioned in another episode. So lack of relationship skills make you vulnerable for individual suffering and increased couple suffering. The strained relationship dynamic makes things harder, right? It just increases the depression symptoms. And it has a ripple effect and a circular effect, right? So bonding with their baby also gets eroded, right? Sometimes their probably enjoyment as parents, their experience of this beautiful time in their lives, right, gets eroded. Research and my clinical experience aligns here. Once relationship functioning improves, anxiety and depression symptoms also improve. And I've seen them improve faster when relationships heal and gain more connection than when there's just individual treatment. So, with your partner, how about tracking these three things? There can be an agreement. Number one, what do we both do in our couple dynamic that gets us feeling lonely or more distressed on our own? Okay. Really important caveat here, and this might be challenging for some couples to do. Can you acknowledge your mutual accountability, that you are both contributing? Not that it's your intention or that there's anything malicious going on, but what is something you're both contributing to, right? That's leading to kind of bigger and bigger walls. Number two, when you're more distressed individually, how does it affect how you treat one another? Okay, so when there's something going on and something's uncomfortable, right, are you able to go to each other, or does it come out in kind of this we're on different sides, kind of way, a punchy way? Number three, how does our conflict with each other affect our confidence with our parenting or how we parent our baby and child? So, for example, sometimes when there's so much distress, especially with depression and anxiety symptoms, there can be something where parents start to, when they're repressing their feelings towards their partner, they can start getting in shame spirals or self-attack spirals. And this can lead to like, I'm a bad parent, kind of narratives about like, I'm a mess or things like that. And this affects how we are relating to our children, right? And then also when we're not dealing with things with our partner, sometimes that anger can get displaced, the impatience or the frustrations can get displaced on the child as well. I hope this is helpful. Definitely will continue going more in depth on couple conflict navigation at this really fragile and special time of postpartum and early parenthood. And if you want all the resources at your fingertips, I'll be offering freebie goodies in the near future. Sign up for my email list at bondsafterbaby.com to get the goods, and subscribe to my podcast and YouTube channel, Bonds After Baby, so you get notified when there's a new episode. I'm here for you and your family. See you next week. Bye.